I'm Simon Katarski. I'm the Senior SQL Database Analyst for Suffolk County Council. I've been with the Council since 2000. This time, became aware of it, was in 1972 when my father fell ill with polycystic kidney, or acute polycystic kidney disease. At that point in time, dialysis was on a postcode lottery, as they used to call it. Unfortunately, we didn't live in the right postcode. My father didn't get dialysis and unfortunately passed away age 42, leaving my mum with 4 boys to bring up. From then I went on to join the army following my older brother. In 1988, I fell ill with a collapsed lung, believe it or not, and during the medical interview they turned around and said, "Mother and father are alive," the usual thing. No, unfortunately my father had died. What had he died of? Polycystic kidneys. Have you ever been checked? No. So I ended up sitting in a queue full of pregnant ladies from army wives in my dressing gown with my collapsed lung for having an ultrasound scan, and found out that I indeed had got polycystic kidneys and cysts on my liver as well. From that point on, I was monitored for kidney function, and then in, I think it was around about 2009, in late 2008, early 2009, my kidney function began to increase to the point where I needed to go on dialysis. At that point as well, I was put on the transplant waiting list, tissue typing and so on and so forth, and I started dialysis at Norfolk and Norwich Hospital. I don't doubt that I'd still be here if I hadn't been lucky enough to get an organ transplant, but from the point of view of how important organ donation is, it is an absolute life changer. I feel fitter now than I did in my late 40s. I weigh a stone less. Yeah, I have bad days, I have good days, but it's a game changer. Do it. Don't think about it, just do it. If you object on religious grounds, I don't have a problem with that, then fine, honour your religion, it's what people should do. But to have apathy, to have the "I'll do it tomorrow," to have the "it'll never happen to me" syndrome, it just doesn't work as far as I'm concerned. You've got to look at it from the point of view, not should I donate an organ, but if I needed an organ, would I want other people to donate? And if I'm in that situation, would I be one of them? It's difficult to put into context how much it affects the whole family, the whole community, even Suffolk County Council, my employees. They get a DBA 5 days a week, as opposed to Wednesday morning, I'm not here. Monday afternoon, I'd leave by 2. Friday afternoon, I'd leave by 2 to be on dialysis until nearly 10 o'clock at night. I'm the complete employee. I'm the complete person. I'm the complete husband. I'm the complete father, grandfather to my step-grandchildren, and so on and so forth. It just changes you completely, and for that I'm eternally grateful.
I'm Mike Collins and I work for business development in the County Council, and this is my daughter Elizabeth, and she is 8. So my wife has arthritis, and arthritis developed. Sometimes arthritis affects your organs as well as your bones, and in this case it affected Paula's lungs to the point that she became very, very ill, and her lung function deteriorated quite quickly, and she then became bedridden, and we had to, the only option to keep her alive was to have a lung transplant. So she was waiting for a lung transplant for 2.5 years, and she was at home on a breathing support system for most of that time. Nearly died a few times, and then had a transplant in 2001, and since then she's been going from strength to strength, and 2007 we had Elizabeth, and I think it's fair to say, would it be fair to say, Elizabeth, that if Mummy hadn't had a transplant, you wouldn't be here? Is that fair?
Yeah.
Yeah. So we are very, very lucky, and Elizabeth has a sister who's born before the transplant, and the two of them now, fight like sisters do, but the bottom line is she wouldn't have a sister and we wouldn't have a daughter if Mum hadn't had a transplant. Well, I guess like a lot of people, I didn't know anything about organ transplantation. I didn't know how many parts of your body you can actually give to other people. It is a true gift. It's a gift of life. It gives people it changes people's lives. The thing about it is that I'm on the list, Elizabeth is on the list, her sister's on the list, all our friends and family are on the list. But the important thing is that you need to discuss this with your loved ones. Because if you don't do it, if the law as it stands states that even though I've signed up and I want to have any part of me given to other people, if Paula at a time of enormous emotional strain said that she didn't want any part of me taken away, then she would have the final say on it, and I wouldn't be able to give any of my organs, even though it's my own wish. So the message I'd give is, please talk to your loved ones about it, but it's a massive, massive gift. It doesn't impact on you only in the sense that it does give some degree of consolation if somebody dies, especially if they die early, to the family, because it's something that you're giving life to other people.
My name's Paula Collins and I'm married to Mike, who works at Suffolk County Council in Endeavour House. Well, before I had my transplant, I didn't have a life at all because I was in bed all the time on a ventilator, so I wasn't able to do anything at all with my eldest daughter at the time, it was from the age of 2.5 to just before she was 5, so I wasn't able to do anything with her, wasn't allowed to go out and play with her, take her anywhere or anything like that. And then obviously when I had my transplant, I could do anything I wanted, which was great. Once you've had your transplant, you're told a very limited amount of information about the person who gave you the organ. You are usually told whether it was a man or a woman and roughly about what age they were, and that's it. You're invited to write a letter to the family that have given the donation, which is then given to the hospital where you've had your organ transplant. That then gets passed on to the hospital where the donation actually came from, and they contact the family and they ask that family whether they wish to receive that letter. And you are never told whether yes they receive it or no they don't, so it's totally up to them. I did write a letter, but I don't actually know whether the family actually accepted it or not. I hope they did, because just to say thank you, and the words of thank you are insignificant compared to what they've given me. Not only have they given me my life back, but they've given me Elizabeth, and I lead a fantastic, very full, lovely life, and I'm incredibly grateful.
My name is Ian Maxwell. I work in Children and Young People Services in schools infrastructure, where we commission school places, do pupil forecasting and issues around that. In 2008, around about October time, I was diagnosed with chronic kidney failure, which is an incurable disease, and it caught me totally by surprise as I had no idea that my kidneys were failing. I was taken to Addenbrooke's Hospital, where they had some tests done over the next kind of 12 to 15 months, and by the late 2009 I was told that I would be put on the organ waiting list, so that at some stage in the future I would hopefully get a new kidney, which would resolve most of the issues of my health. And they were expecting me to be put on dialysis in spring of 2010. So come the 3rd of January 2010, my name was put on the register. The normal waiting time at that time was about 5 years for a new kidney to arrive. So I was not looking forward to being on dialysis 3 times a week for the next 5 years, for every week of that time. To my astonishment, within 2 weeks, I had a call from Addenbrooke's to say that a kidney had been found that was suitable for my circumstances. It matched my blood type and tissues, and was told to rush into the hospital. And this was about 11 o'clock in the morning one Sunday. And so by travelling across to Addenbrooke's, I went through the various tests, and by 6 o'clock that night, I was in the operating theatre receiving my new kidney. And it's taken, a couple of years to get used to the whole situation. But right now, nearly 6 years later, I feel great. People who donate organs are extremely brave. I have a huge amount of admiration for them because it's not an easy decision to take. You can be a living donor as well as a deceased donor, and so donating your organs in either circumstance is a very brave decision to take. But we all take our health for granted. I did. I had really not much idea about anything to do with my kidneys or how bad they were. It just happened totally out of the blue after a general blood test. Since having had the transplant, it makes you realise just how lucky you are to have your health, and for someone to have donated one of their own organs so that I can live and start a second life is just beyond belief, because otherwise I would probably still be on dialysis. I might be lucky enough to have another kidney by now, but it does transform your life. As I say, it gives you a second lease on life, and that person has passed away. They died so I could live. Don't hesitate. Do it right away, because you never know what can happen in life. Things can happen very quickly, as we all know. It can be turned around very quickly. But nonetheless, you have to consider the consequences of what happens. As I say, you don't have to be dead or have passed away to donate an organ. You can be a living donor for a kidney, part of your lung, your liver, for example. And so it's an important thing to think about, but also think of the consequences that you are helping to save and transform another person's life. And if you do pass away, then, and your organs are used to the full extent, you could save up to 7 people's lives just by one person. So think about it. Don't wait too long, because everybody out there who's on the transplant list needs an organ as quickly as possible. There's a massive gap between the supply and demand, and we want to narrow that gap by encouraging more and more people to go on the register.
I'm Jill Corwin. I'm Head of Transformation, Change and Programmes for the County Council. My granddaughter Evie, she's 2.5. She's in Great Ormond Street Hospital. She's been there, and also Evelina's, another London Children's Hospital, since the beginning of May. And she won't leave there until she gets a new heart. I think with your children and your grandchildren, the one thing you want more than anything is for them to be healthy and lead active and fulfilled lives. And you almost take it for granted. We've no history of any serious illness or anything in our family. So, and this isn't a condition that Evie was born with. It was something that transpired shortly after her 2nd birthday, when she had heart failure and was diagnosed with something called dilated myocardiopathy. And it's that real shock of something that you hold so precious suddenly being really threatened that actually she could be taken away from us. And it just throws your life into complete turmoil, and it makes you realise what's important in life, obviously. But it also made us as a family think so much more about organ donation. So my husband and I, we signed up as donors quite a long time ago, and I can remember us having the conversation. At that point our children were younger, and I can remember us having the conversation of sort of almost patting ourselves on the back. Yes, we've signed up, job done. We made sure we were really clear about our wishes. We spoke to our children so they knew what our wishes were. We thought we'd done it. Never in a million years did we consider our children as being potential organ donors, because you just don't go there, you don't think about it. Yet that is the awful starkness of the situation that we have, that in order for our granddaughter to live, another family has to take that massively brave decision that they lose a child, and to be able to kind of say yes, and we want part of them to live on, we're happy for their organs to live at the most traumatic, awful time you can ever imagine. And so it's made us and our wider family and friends sort of think about that, and think about having those conversations about children's organ donation when your children are fit and healthy, and you can have that in a less emotional way. You hear stories of people who do it, it's incredibly brave, but that's the thing for us, it's made us think so much more about kind of our own mortality, and also appreciate the fantastic work that the NHS does, because the care that Evie's getting in Great Ormond Street is absolutely incredible. I would say there are the organ donation registered people, they have a helpline, they have web chat and things like that. So if you've got any anxieties, there are professionals there whom you can talk to. But my experience, and this is in the context of children, I had no idea how many children were waiting for organs. It's not something that you see too much about. Yes, there was a programme recently about Great Ormond Street, but it's not something that you hear about an awful lot. So Eve is in a little bay on a ward with 4 other children with Berlin hearts, mechanical hearts, that's keeping their hearts going, and they won't leave there, any of them, until they have a heart transplant.